I've seen a ton of kids who have like OCD and this autoimmune encephalitis picture that's so severe that they cannot function. And when we get them on the right antibiotics, like the psychiatric symptoms just can disappear. They literally like it's like I would never believe it if I didn't see it because it's so counter and so radical, so counter to like what we know about traditional medicine. But it's amazing. I've
That
seen
is, yeah,
phenomenal.
that's, it is amazing. And I really believe that as we keep moving forward, I think we're going to find that a lot of people that have psychiatric conditions have some kind of infection or, I mean, it would be amazing, of course, if things went in that direction and we saw people get better like that, because that's an amazing story.
Yeah, thank you. I mean I have so many like that. I have a little kid who usually kids present with psych symptoms, the ones that I see anyway. Maybe I have a bias in the sense that I'm a psychiatrist, but I saw a 7-year-old whose parents actually had just bought a house upstate and within a month after buying this house last summer, the kid presents with like blurred vision and these episodic neurological symptoms and pain in his legs. It was very strange presentation, but like a little kid, very concerning. So the mother of the child was friends with another mother of one of the boys in his class who I had seen at Columbia many years ago. And so credit to that woman. She's like, have you thought about tick-borne illness? Because the symptoms seem like tick-borne illness. So they came to see me. We did the full workup. He was positive for Bartonella in his blood, so we found evidence of the bacteria in his blood. We talked about all of the options that we could take a few different routes in terms of like most conservative to most aggressive treatment. So together we decided to treat him as aggressively as we could. And within 2 months, his symptoms were completely gone. That's an example of we actually identified it pretty quickly within a couple of months and we found what was going on and he got much better. So most of the time, often like I'm seeing more patients early on, but unfortunately, when you have a delayed diagnosis and like you then we diagnose it years after the infection
Yeah.
has kind of been causing problems, it's a lot harder to treat.